Here's a CT scan that was performed with intravenous contrast in a patient who was having upper GI bleeding. Now, looking at the esophagus here, we can see that there are a number of small vessels involving the esophagus and the proximal portion of the stomach, and so these end up being gastroesophageal varices. Gastroesophageal varices are primarily seen in the setting of cirrhosis, and so we'll take a close look at the liver, and sure enough, when you look at the liver surface contour, it does appear nodular. Coming down a little bit more inferiorly, you can see the nodularity of the liver more inferiorly. And so this is a patient who actually did have cirrhosis that led to portal hypertension and esophageal and gastric varices. Now, the other finding in this particular patient is that if we come down lower and we start looking at the colon, it looks like there's colonic wall thickening and edema and so forth. And so usually in a patient we think about colitis as something that can cause edematous inflammatory changes involving the colon. But in a patient who has portal hypertension, one of the things to think about as well is, could this be related to the portal hypertension? The right colon is usually affected more than the left colon, and sometimes it can involve a portion of the transverse colon, but essentially this is just from edematous changes from the portal hypertension, that the venous flow is not able to get back as much, and so therefore you get this kind of thickened appearance and what essentially looks like an inflamed appearance of the colon, but really this is just a manifestation of portal hypertension. You can see in this patient here, once you get to the hepatic flexure, the transverse colon looks normal, and so this is the right colon that's involved. The left colon looks uninvolved, and so this is a patient that ends up having portal colopathy in the setting of portal hypertension from cirrhosis.